Hey, Coach Oz here. This video is just going to I'm just going to talk about the benefits of foam rolling and what foam rolling so-called is and what it does. And but as for the actual individual foam rolling movements, they're going to be also on separate videos themselves. So I'll do basically all the common areas of the foam rollers, but I'm going to split it and do them kind of each individual video, and certainly you'll be able to have the link for that. But today's talk is just more so about foam rolling, what it is. It depends on, I guess, if you do utilize foam rolling into your weekly routine. Some of you, this may be pretty well foreign in terms of what a foam roller is, what it does. You haven't really, you may have heard about it, but you not necessarily have incorporated into your routine, or this may be the very first time that you've actually heard about it. So what foam rolling is I'll put it kind of just in terms of how your body is actually organized. And foam rolling is basically a form of what's called myofascial release. So when you think about a massage therapist who gets in and they do therapeutic massage with their elbows and their thumbs and their hands, that's a form of myofascial release, meaning that trigger points that are on the surface of pretty well all your muscles, just caused by your posture, caused by your work demands, life demands. Even if you're a very active individual, you can certainly develop a lot of adhesions and trigger points within the fascia of the muscle. And obviously foam rolling and massage therapy is basically a form of trying to help reduce tension, stiffness, increase even mobility at a joint, and just kind of help remove some of those big kind of so-called knots, which are basically a form of trigger points in your muscles. And what is fascia? Well, fascia, if you think about what ground beef is, or like ground meat, you see the saran wrap that's over top. Well, that is basically when you remove your skin and you remove obviously the outer fat layer. Fascia is kind of almost like a translucent cartilage and material, soft tissue material that covers pretty well all joints and muscle, right from the base of your foot right up to the base of your skull. So fascia, in many cases, when someone says, I'm tight, I got really poor flexibility, in many cases, just actually helping to relieve some of the tightness and trigger points within fascia can actually do wonders in actually how you feel and how you move, and reducing the tension. So not always it may be, oh, well, that muscle is tight, like the actual belly of the muscle is tight. Many cases, it's that so-called outer covering that looks almost like, when you think about what a trigger point looks like, it's almost like a mat of like a spider web, or like yarn that's just kind of mangled every which way. That's what a trigger point looks like. And ideally, you kind of want fascia and fibers, connective tissue fibers, that run kind of smoothly and in one direction, or in at least the same direction. So foam rolling is basically, like I said, a cheap form of massage therapy, but you're basically just applying pressure via your body weight on top of, say, a tube like this. And obviously you got long tubes, some are very soft, some are very hard, some have knobs on them, and all you're trying to do there is help to slowly, as you roll over a belly of the muscle and whatnot, if it's discomforting, then immediately right there and then, it's a pretty immediate feedback to tell you that you have basically tension and adhesions and trigger points, all those things built within parts of the muscle. And for certain people, it may be certain muscles that are certainly much more, versus they may not necessarily feel a whole lot when they do other parts of their body. But everybody's different. Again, it's all about kind of your active routine, your work life, your posture all plays a big role. But you're basically just looking at 30 to 45 seconds, rolling pretty slowly over the belly of the muscle to help reduce tension and trigger points and so-called stiffness within the fascia so that when you certainly, and ideally it's best to be done, say, prior to a workout. You could certainly do it at any time of the day. It could be, say, in the evening. You could do it even prior to stretching, because what foam rolling or even massage will do is it kind of opens up the joint. It opens up the belly of the muscle so that you can almost feel immediate improvements to your mobility. But then when you actually focus on doing stretches or some specific mobility exercises, you're more apt to really stress and stretch the muscle itself when the fascia, the over-covering layer, has been so-called more relaxed, in a relaxed state. So ideally, like I said, foam rolling is done prior to your workout to really get kind of the true benefits of it. But again, it could certainly be done by itself at any time of the day, or even post-workout for that matter. That should be about it. That just kind of in a nutshell covers the benefits of foam rolling. I always say consistency is the best policy. If you do foam rolling on a regular basis, it can really show benefits in terms of reducing tension and stiffness. I've seen dramatic changes with current clients and former clients that have really kind of stuck to it and utilized it on a regular basis. If you just use it every often, every so here and there, honestly, you're not going to get much benefit. The other key component of it is when you are sore. So when you finish a workout, say the day before, the next day you have some tenderness in the muscle. Yes, foam rolling may be an absolute a harsh thing to do when the muscle is sore, because you're rolling over a muscle that is already, like I said, kind of in an active state. So it can be quite discomforting when you do it when you are already kind of already sore. But it has been shown to help, so-called, with that recovery process. So to help alleviate that muscle soreness that you would get following certain workouts, leg workouts, upper body workouts. So this can certainly be your friend if utilized on a regular basis. And again, if you're just starting out using it, then I would say go to a softer foam roller, and then as you become a little bit more adapt to it, then that's where you want to grab a more denser, harder, or one of those foam rollers that got even those knobs on it. I wouldn't certainly probably suggest that right off the hop, because it'll probably be too discomforting. But again, don't be alarmed if it is discomforting. That's just literally the apparatus telling you that you have trigger points and tightness throughout certain parts of your body. So you want to certainly get that, work that in order to feel and move better. Anywho, that should be all for today.